Hi, everyone, and welcome back. I'm so excited to have the patient Susan with us today, and I've got a little history behind her. She has insomnia, and I would love for her to tell a little bit about her story. Susan, welcome. So tell me, how long have you had insomnia?
Since I have known Dr. Cole, who is the most amazing physician I've ever met in my life, and that is quite a number of years.
And what has been the most difficult thing of your insomnia? Do you have trouble falling asleep, trouble staying asleep, or do you wake up really early in the morning and can't go back to sleep?
Oh, I don't wake up real early in the morning. In fact, I wake up too late in the morning
Okay,
because I go to sleep very late, or I had been going to sleep very late. And after the 11 o'clock news, and sometimes after that.
okay,
So by the time I fall asleep, it's at least midnight or
okay.
maybe later. And then waking up is very difficult. And I was waking up with headaches. I was feeling like I was getting dementia because I would forget things. I would have
Absolutely.
difficulty playing bridge, mahjong, counting the cards, remembering the lines. And in fact, I saw a neurologist who thought perhaps I did have dementia.
Sure, sure. And I think, unfortunately, that can be common, the fear of dementia or sometimes even depression or other psychiatric or neurological disorders. So you mentioned these other diagnoses that you had and some of the symptoms you had, the headaches, difficulty functioning during the day. How did it affect your social life?
It impacted it in a way that was not very desirable because I began to avoid my friends unless I knew there was a scripted meeting, and like going to a show, perhaps going out to dinner with several people so that there would be enough people to distract attention away from me.
Sure.
And it was a negative kind of feeling. I had great anxiety, not just about the way the world is going, but of course the way I was going.
Sure, sure, absolutely. And what kind of things did you do while you were home? Were you taking naps during the day? Did that seem to help, or did
I
you avoid
tried to
taking
take
naps?
naps. I thought, okay, it says you're allowed to take a 20-minute nap. That never happened. I would lay down like around 3 o'clock, and then it would be 4:30 before I would get up, which of course exacerbated the situation because then I absolutely could not go to sleep.
At nighttime? What about exercise? Did you try increasing exercise at all? Did that help or not help?
Actually, yes, I did start to exercise. What I didn't recognize was that I was trying to exercise at 8 o'clock at night. So I would go out for my very rapid walk, jogging, and then I would come home and I felt, exhausted, but in a good way. And I suppose that did help me get to sleep a little earlier,
Sure.
along with some medication. I have to say, I'm still taking medication, but it's not the kind of medication that is very potent.
Sure, sure. And I think that's important. Some people really want that potent feeling so they can fall asleep quickly, although they've had insomnia for many decades. When you saw your sleep specialist, what do you think was the one thing or the two things that helped the most in terms of improving your insomnia?
Well, first, Dr. Cole did identify that I had sleep apnea, and I thought that would solve all my problems. I was very grateful. She found a way for me to get off the CPAP and use a dental appliance. I
Good.
thought that was the end. No, it was not. Um, I know I had very much reduced sleep apnea, but I was still waking up several times during the night. I was not able to get to sleep at a reasonable hour, and I was waking up too late. So it was a very disturbing sequence because I thought, here I had it all solved, and I did not at all. Now, Dr. Cole also recommended many sleep strategies.
Good. Good.
I'm one of her worst patients
I doubt that. I doubt.
because I doubted all of them. Mindfulness, turning off the TV, that was torture.
Very common. Very
Um,
common.
however, I have learned recently that one at a time I have begun to take her advice. Reluctantly, begrudgingly, I turn off the TV at 11 o'clock. I do not let it go any further than that.
Good.
At first, it was hard to fall asleep, even with the little medication, but now it is not. Within 10 minutes, I say I do fall asleep.
And I
So,
think what you described is fantastic. I mean, like you said, you thought it would be better with sleep apnea. You stuck with your doctor. You got the appropriate questions. You were doubtful, which a lot of patients are, but you stuck with the program and now you see benefit. Susan, we see so many patients like you. And I just thank you so much for your time. You just put a face with the disorder and it just makes it easier for all of us. Thank you so much for being here today.
thank you for having me.
Hope you guys learned something today and we will see you soon.
Thank you. Bye.